Okay, you can send the next patient in. Thank you. Hi. Hi, how are you? Of course, you're not good if you're here, right? Yeah. Okay, let me introduce myself. I am Dr. Green. How are you? Good. Okay. First things first, are you new here or do we already have a folder open for you? We do not. Okay. I am gonna get that started. In the meantime, I'm gonna ask you a few questions and please answer them, okay, to the best of your ability. Thank you. So what is your name? Okay. How do you spell that? Okay. I am so sorry for the background noise. People have brought their children also, so you know anyway there's kids, there's gonna be crying. Okay. And your surname, please. How do you spell that? Okay, perfect. Can I get the date of birth? Yeah. Can you please start with your year, the month, and then the day? Okay. Perfect. You're so young. Can I please get the reason you're here? How can I be of service to you, please? Yes, just hold on. Sharon, can you please check on the children outside? They are making such a noise. Yes. Thank you so much. Reason, yes, you are. Okay. You have something in your eye. Now this something, how long have you had it now? A couple of months. Damn. Okay. Have you had any other symptoms other than the something in your eye? So have you been having any headaches that come and go? Do you think they're connected to your eye? Have you been having a sore tooth, maybe a sore ear connected to your eye? Okay. Headache. How bad and how often would you get them? Yeah. Damn, that's a lot. Okay. Okay. And what have you taken for the headache? Have you been taking any medication? Just your standard painkillers. What type of painkillers? Okay. Okay. Now that I am done with this part of the procedure, we are gonna do I'm just gonna take your temperature. I'm gonna check if your breathing is okay, and then we are gonna dive right into the eye. Is that okay with you? Yes. Thank you. So now, for the temperature, I'm gonna use this thermometer quickly, and I'm gonna put it, insert it in your mouth, and then that's it, okay? It won't be so. Okay. Okay, just open your mouth for me, please. Thank you. Close your mouth. There we go. Open. Thank you. I'll just set it off to the side while it's still reading. What else did I say I'm gonna do? I said I'm gonna check your breathing. I'm sorry, it's been such a long day. So can you please just breathe in for me, okay? And it's gonna be a little bit cold, okay? So just lift up your shirt for me, please. And I'm gonna put this on you. You're gonna breathe in when I say so, breathe out when I say so. Is that okay? Don't worry, it's just gonna be cold. Okay. Ready? Breathe in for me, please. Okay. Breathe out. Breathe in for me, please. eye so I can see clearer. Okay, is that okay? Brush, 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 brush your lashes, brush your lashes, brush your lashes, brush the lashes, brush the lashes, brush, brush, brush your lashes, brush your lashes, brush your lashes, brush, 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 brush your lashes away, brush your lashes, brush, 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 brush. Now I'm gonna go to your lower lash line, okay? I'm just gonna go to your lower lash line quickly. I'm just gonna go into your lower lash line. Is that okay? So continue holding it for me, and I'm just gonna go to your lower lash line, lower lash line for me. Your lower lash line, I'm gonna brush your lower lash line for me. Brush your lower lash line, brushing the lower lash line. I'm gonna brush the lower lash line. Your lower lash line. I'm gonna brush the lower line. I'm just gonna brush the lower lash line quickly. Then brush your lower lash line. Brush the lower lash line quickly. Okay, now that the hair is out of the way, what I am observing is a lot of pus area around your eye quick, and it is like that's what's really making your eye stink and have a stench. So let me just note down my observations. Yeah, is it itchy? I can imagine. Pus around the eye, smelly, loss of lashes. I was gonna say lash hair. Okay. Yeah, it seems to me that your eye actually has an infection. I'm just gonna use my magnifying glass to just further look deeply into there. Maybe it affected the surrounding areas. Is that okay with you? Okay, perfect. So again, I just want you to hold open quickly, okay? Just hold it open, hold it open. Just check. Let me just get a little bit closer, just so I can see what's happening with your eye. See what's happening with your eye. Let me see what's happening with your eye quickly. Let me see what's happening with your eye quickly. Get a little bit closer there, a little bit closer so I can see. Let me just get a little bit closer to your eye so I can see quickly. Is that okay? Just wanted to see. Wanted to see. Let me use this side. See, okay. I can see where it's okay. Get a little bit closer there, a little bit closer there. The eye, don't mind if you like just touch. I'm just gonna touch around. I'm just gonna touch you around. I'm gonna touch you around. Don't be afraid. Don't be afraid. It's okay. Just oh wait. This is gonna be a tough one. So your eye is definitely suffering from a severe infection right now, on top of the fact that there was something in it. So, severe eye infection. What I am going to prescribe right now and recommend is for us to first take away and heal the infection, right, by using antibiotics, and then about a couple of weeks later you're going to come back in for a follow-up, and then we are going to go into surgery because that's what it's going to need. Okay, is that okay with you? Yes, no problem. So I am prescribing you some very, 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 very strong antibiotics. Please, no alcohol with this, no smoking with this for the next 7 days, okay? And you take them exposure to sun. Okay, so do not, do not, do not, do not, do not put these very carelessly. Please put them at the top of your shelf, somewhere deep, somewhere dark, somewhere far from the light. Is that okay? Okay. Okay. So again, do not worry these up for you. Hold on to these, and please, when you get to the front desk, ask them to give you a bag. Well, they will give you a bag because they're also going to give you complimentary painkillers again on your way out. Okay, just show them this, and I'm going to give you a prescription, and you show them the prescription that I wrote you for you in case. Okay, this is for you. Here we go. I'm gonna put it right here. And then, yeah, I will be seeing you in about 2 weeks when the swelling has went down and it will be time for surgery. In the meantime, please stay away from this friend. Stay away from anybody who